Good evening, doctors. It's so good to see all your faces here on Zoom. Thank you for joining us tonight. And again, welcome to our second Doctors Forum for 2020. As Ms. Germaine has shared, this will not be our last Doctors Forum. In fact, the Doctors Forum will now become a regular event. So please mark your calendars for the last week of every month. We will be introducing a Doctors Forum for a new topic every single month. So this is aimed to equip all the doctors who are using our products on new information, on protocols specific to specific illnesses and disease. So please mark them down on our calendar and join us monthly. It's also a good time to exchange successes with patients using our protocols and your protocols and our products, and also to encourage one another. Most of the doctors here actually know one another anyway. So it's another great time where you could catch up. You can private chat among each other, exchange notes. And more importantly, we will invite special guests like Mr. Jack Wei from Taiwan tonight, who will join us as a panelist. So Mr. Jack Wei is available for questions, and he will answer any questions specific to the product or in general if he can. So without further ado, let's jump into our topic tonight. Tonight's topic is about lungs and how SimplyNature PPARs can be used to treat lung infections. This is not only a timely topic, it is an important topic right now because Philippines has now been earmarked as the hotspot for COVID-19 infections here in Southeast Asia. And it doesn't look like things are going to change much moving towards the end of the year and even into 2021. Here in Philippines, we've been locked down for 6 months now. I know, Doc, we had our last Doctors Forum during the ECQ. Well, now it's almost 6 months later. We're still in GCQ. I think this is really important that we come up with treatments as well as protection. So this is something that today's topic will be relevant. And I really think that it's important for us as a community, both as SimplyNature as a company and our doctors yourselves, who are our partners, that we are able to contribute to Philippines coming out of the pandemic. I say this because even President Duterte has made the announcement, right, his cabinet, that we can't do lockdowns, broad lockdowns anymore. And the reason is very simple. He actually said that the nation Philippines doesn't have money to pay people who are not working. So I think this is really important. I've also had a lot of feedback from doctors in our group that clinics are suffering, that there are many clinics have not been open, and even hospitals are only seeing about 20% of their usual, business because people are afraid. People are afraid of even going to the hospitals to receive treatment. I think this is definitely going to hit us and change us as a nation, Philippines. So we've got to overcome this fear. So I hope tonight we will talk about the things that we talk about will inspire some, encouraging news that you can share with your patients. And I think it's really important for us to, again, as a nation, to not be overcome by fear. And in order to do that, we really got to have tools in our hands, tools for prevention and protection, as well as effective tools for treatment as well. All right, so tonight the talk will be structured this way. Right? I'll be covering the major concerns. What are major lung diseases that we are concerned with in general, and what are the important natural or integrative approaches to treating lung infections and lung diseases like pneumonia, bronchitis, so on and so forth, right? And how SimplyNature PPAR falls into those protocols, natural protocols. We will actually then go into detail on one of our research papers that was published, and that's the study of the allergies. And that, again, is related to the lungs and the immune system and how that all ties up together. And that will tie up together with the COVID-19 situation. And we will end up by having a recap on lung cancer since we are talking about lungs today. All right. And I would like to really welcome Mr. Jack Wei because he's joining us all the way from Taiwan. Mr. Jack Wei will be part of the panelists for any of your questions and answers for the Q&A today. So anytime you have any questions, just feel free to chat, key it into the chat box, and we will do our best to prepare the answers and get back to you during this Doctors Forum. All right, so let's start with looking at the different common lung infections and lung diseases that we deal with here in the Philippines. The common lung diseases that we face in the Philippines is the same as the rest of the world. They are namely asthma, bronchitis, pneumonia, tuberculosis, COPD of different causes. These diseases are very familiar to all the doctors here this evening, and I am very sure that you're also very familiar with all the conventional treatments for these diseases. But tonight, what we're gonna do is we're gonna take a look at the two main strategies from the natural approach, how you would use, what natural approaches you would use to complement, to support the conventional prescriptions. For example, for tuberculosis, it will be antibiotics, right? So on the natural side, what are the common protocols that we use to treat lung issues? For the natural protocols, they namely fall into two broad categories. Number one is that we would attempt to lower the inflammation in the patient's body. And we can achieve that through supplementation and through dietary change. The other is to boost the patient's immune system, because with lung diseases, we are usually dealing with infections. Before I jump into the specific research that deals with SimplyNature PPARs and allergies, and in that research, we look at inflammation and the immune system, which is how we basically naturally treat patients with lung issues. I want to just take a quick look at the support prescriptions that are commonly given by integrative doctors for lung patients, be it whether they're going through natural protocols or they're using it to support conventional lung treatment. Okay, so when we take a look at supplementation for support, we often see that vitamins and minerals and supplements that are rich in antioxidants and anti-inflammatory, strong anti-inflammatory properties will be the ones that are recommended. So we are looking at supplements that contain vitamin C, vitamin E, beta carotene, vitamin D, omega-3s, fatty acids. All these are crucial to the patient's nutritional requirements for a healthy, strong immune system, as well as a body that's less likely to be inflamed. All right. So many of our doctors tonight, you may not be totally aware of the actual nutritional content found in our tablets. And our SimplyNature PPAR tablets are actually the go-to foundational supplement that you can start almost all your patients on. That's because we contain almost all, if not all, of the normally recommended vitamins and minerals that you would usually prescribe to your patients. So let's just take about 2 or 3 minutes to run through specifically what does SimplyNature PPAR tablets contain when it comes to vitamins and minerals. Okay, let's start taking a look at the SimplyNature PPAR Plus tablets. I know for all the doctors here this evening, you know, when you think about SimplyNature products, you are often thinking about the impact on the immune system, on the dendritic cell, the gene activators that start all the pathways that control metabolic pathway, the immune response pathway, the inflammatory response pathway. Well, we'll cover that very soon in about 5 minutes when we talk about the research paper that we did on allergies, because there we will focus on the immune system and how SimplyNature phytonutrients and the PPAR agonists actually impacts the immune system. But right now, let's take a look at the basic nutritional profile. You know, don't forget, SimplyNature PPAR tablets are actually superfoods, all right? So they are actually the foundational prescription that you can use to support your patients regardless of the protocols that you're giving them. all right? Because even if you're giving them high doses of vitamin C, you still need the other nutritional inputs for a strong immune system, like fatty acids, zinc, okay, and so on and so forth, all the different minerals and vitamins, all right? So let's take a look first at the general nutritional profile of PPAR Plus tablets. Number one, when we take a look at this, we'll take a look at the dosage of 20 micro tablets. That's 10 micro tablets 2 times a day. That will be equivalent to 4 grams of SimplyNature PPAR microalgae plus grape skin polyphenols. That's what is in your PPAR Plus tablets, all right? Now let's take a look at the general profile. Number one, they're getting a lot of plant protein. It's 2.3 grams of healthy plant protein for every 4 grams, for every 20 micro tablets. You get complete amino acid profile that you usually can't find in plants because amino profiles are more complete in meat, all right? You have high CGF, almost at least twice that of the common CGF levels found in common brands of chlorella, all right? We get 2 times the CGF as normal chlorella. It's rich in minerals and vitamins, which I will detail. And when it comes to chlorophyll, all right, chlorophyll is, one cup of spinach, all right, will give you about 24 milligrams of chlorophyll. But just 20 micro tablets or 4 grams of SimplyNature PPAR Plus tablets will actually give you 89 milligrams of chlorophyll. That's almost equivalent to 4 cups of spinach. So just this 20 micro tablets is the same as 4 cups of spinach worth of chlorophyll. So you can see our SimplyNature PPAR Plus micro tablets are really just superfoods. In fact, it's like 1 cup of mixed vegetable gives you 2.4 grams of protein. 20 tablets, 4 grams of our SimplyNature PPAR tablets also gives you 2.3 grams of plant protein. So 140 gram cup of vegetables will give you the same amount of plant protein as just 4 grams or 20 micro tablets of our SimplyNature PPAR tablets. Amazing, isn't it? All right, but I want to go now to the actual vitamins and minerals that are found in our SimplyNature PPAR tablets, because many of our doctors here, some of you practice orthomolecular medicine, functional medicine, so the actual content of the types of vitamins and minerals found is important to you. So let me detail that right now. As we take a look at the vitamin and mineral content of the SimplyNature PPAR Plus tablets, I would like everyone to take note that we are not the same as a vitamin E capsule. It's really comparing apples to oranges. It's like comparing a beta carotene extract versus a carrot, all right? Both contain beta carotene, and obviously the beta carotene extract is a concentrate, and it has probably more beta carotene than a normal carrot. However, a normal carrot has 200 forms of beta carotene and other minerals and vitamins that go together with the beta carotene to actually be effective in your body, because this is God's recipe, right? God designed the carrot versus a manufacturer designed the beta carotene extract. Okay, so when you take a look at SimplyNature PPAR's tablets, look at it as the most natural form of supplementation you can give to your client, all right, and your patient. So basically, again, they're eating a superfood. Now let's run through the list of vitamins and minerals that are found in the SimplyNature PPAR tablets. Let's go into the vitamins and minerals right now. So we have vitamin A, B, C, D, and E. All are available and found naturally in SimplyNature PPAR Plus tablets. That's all the vitamins that you need to support a strong immune system. Dr. Gel also shared in one of his webinars with us that you need fatty acids, specifically omega-3s, for a strong immune system. And guess what? In our fatty acid content, 20% is actually alpha-linolenic acid. So we actually have omega-3s naturally found in our SimplyNature PPAR Plus tablets. And on the mineral side, we have calcium, iron, zinc, selenium. So these are also, again, the basic minerals that you you require for a strong, healthy immune system. Okay, so I hope that helps in terms of the vitamins and mineral content. Now let's take a look in summary. In summary, Simply Nature PPAR Plus tablets are the best plant-based whole food you can prescribe to your patient. And some doctors might be thinking right now, why not a cocktail of multivitamins and minerals instead? Well, my answer is there is absolutely nothing wrong with a cocktail of vitamins and minerals. In fact, many of our top orthomolecular practitioners who use our products do that. Now, what is important is to take note when you want to use Simply Nature PPAR tablets. And the answer is as a foundational food supplement for your patients, because it is a plant-based whole food. It's not an extract, all right? And whatever they get is easily bioavailable. It'll cover a wide range of vitamin and mineral content that your client and patient needs. It has the chlorophyll, it has the fatty acids, it has all the vitamins and the minerals. So what you use it for is a foundational, to lay the foundation, and then have your vitamin C high dose, all right, if that's what the client needs. Also, don't forget, you're not only giving the client the vitamin and mineral requirements, you are actually giving them something with a therapeutic effect, because the Simply Nature PPAR tablets alone is effective for lowering blood cholesterol as well as managing blood sugar and also inflammation. So you get all the gout, the general mild gout, diabetes, blood cholesterol, inflammation. It's also a kidney liver aid. If you don't know, ask some of our doctors from Prima. They can share with you how if you take the tablets, it's not as easy to get high or drunk on alcohol, because it actually helps. It's a liver aid. So your patient is getting all that, not just a vitamin D or E, right? They're getting all this foundational support for the total functioning of their body. And this will work well with the additional specific fortification that you might want to give them. For example, again, high dose of vitamin C. Okay, so this is where we will stop when we come to support therapy or supplementation for patients with lung issues. Right now, I want to jump straight into the research, and we can go into detail about how Simply Nature PPAR extracts, the soft gels, the powder and the liquid, because when it comes to actual treatment, just the tablets alone would not be enough, because that's really for support. Actual treatment will really start with the extracts. So we're talking about the soft gels, the powder, and the liquid. We're going to talk about how that actually impacts the immune system and how that impacts lung diseases. All right, let's move on to the research portion of today's Doctors Forum. I think this is an enjoyable topic and one that's really interesting because of the backdrop that we're in. This research was done a few years ago, and it is heavily focused on the immune system because that's what happens when we do research on allergies, right? How the body reacts. In the backdrop of COVID-19, of course, the hot topic right now is every country and pharmaceutical companies from every country are rushing towards getting a vaccine out. However, WHO and experts all over the world have actually cautioned us or tempered our expectations of vaccines, because vaccines need to be targeted for viruses like the COVID-19 and the regular flu virus. So they have to be updated as the viruses mutate a lot. And if you don't update them, then they don't really work that well. And even when they work, they don't work 100%. So most flu vaccines sort of reduce your risk of getting the flu virus anywhere from 50 to 80%, but it is not a foolproof thing. What's really important to health experts and WHO as well is not only the vaccine, but actually a treatment for COVID-19. And this really ties into the research that we are going to discuss today, and I think it's really interesting. We will take a refresher course for all the doctors here. We'll be looking again at the immune system. So all these buzzwords that's been being thrown around, antigens, antibodies, all these terms, IL-12, IL-6, IL-4, all these things are what we're going to look at in a few minutes. All right. So what I'm going to do is I'm going to flash slides and we'll just go through briefly the technical details. So today will be a little bit technical. If you have any questions, we have our expert, Mr. Jack Wei, waiting at the side to answer any of your questions, but I'll do the presentation because it's a bit technical. So I think English would be an easier medium for us to present this data. All right, and let's dive in. So I want to start by saying that some of our doctors, in fact, many of our doctors here in Philippines have been using SimplyNature liquid extract, soft gel, and powder extract successfully for the fight against COVID-19. Now, we are actually framing this discussion with the COVID-19 at hand, because even though the topic's on lung, one of the ways COVID-19 really complicates things is with, of course, respiratory infection and complications, right? So it's actually totally related. So yeah, off the bat, I just want to say that once we deal with a COVID positive patient, we really need to move into the extracts. So we are talking about the soft gel, the powder extract, and the liquid extract. For prevention and for support, definitely the SimplyNature PPAR Plus tablets are great. They are the best line of defense for healthy people. And as we all know, for COVID-19, if you are at risk, if you have pre-existing conditions. So right now, again, we can prescribe patients with vitamin D, vitamin E, vitamin C, but that will not get rid of their pre-existing conditions. So that's why SimplyNature PPAR Plus tablets is really the best strategy for most persons, most Filipinos, in terms of their protection for COVID-19. Because the Plus tablets not only provide you the vitamins, the minerals, the omega-3s, all these nutrients that we all agree on that will be great for boosting the immune system and help control inflammation in the body, and hence, well, just make infection a lot harder. But it also is already proven to be effective for blood sugar, blood cholesterol, hypertension, cardiovascular issues, rheumatoid arthritis. So PPAR Plus tablets have already been proven to be effective for this. So while patients are boosting their immune system by taking PPAR Plus tablets, they are also making themselves no longer belonging to the at-risk group, because we are dealing with their underlying conditions. So I hope for the doctors with us today, you can explain to your patient that not only is the PPAR Plus tablet great as an immune booster and protection, but this is something that, for them to also take note of their diabetes and blood cholesterol, because these will be dealt with to further protect them and take them out of the at-risk group. Okay, let's jump back onto the research again. We want to start by showing you this slide. This is this slide shows that it's from the Taiwan FDA. They actually made a statement to say that the research project shows that the efficacy of SimplyNature PPAR extract on H5N1 infection of ferrets. So we did this, and we infected ferrets with the H5N1 virus, and you know that virus is actually a pretty scary virus, because the mortality rate is 90% for that one. All right, but it showed in our experiment that the viral load on the ferrets actually dropped. All right, when they were treated with liquid extract from SimplyNature PPAR's liquid extract. So take a look at this other summary. This data shows that our extracts, the soft gel, extract powder, and extract liquid, it has the ability to increase the ability of immune cell proliferation, increase phagocytic activity of peritoneal, increase natural killer cell activity, regulate T cell immunity, promote immune antibody formation. All this, of course, is very important and effective for the treatment of lung diseases, because lung diseases are mostly infections, right? But this right now is very applicable to the COVID-19. Take a look at this other summary. So this data shows that we increase the ability of immune cell proliferation, the regulation of T cells immunity, and we reduce allergic immune antibody formation. All right. Okay. Now let's take a quick brief look at the immune cell. In fact, I want to thank Dr. Joel, because we just did a webinar recently with Dr. Joel a couple of months ago, actually, I think 2 months ago, on the immune system. And Dr. Joel did a great job on talking about innate immunity and adaptive immunity. So today we are really going to talk about both, actually. Let's move on to the next slide. You can take a look here. This is what actually happens when in our experiment and the published journal, our report. Basically, it says that our liquid extract, and actually the soft gel is a smaller quantity of the liquid extract. Okay, so even the soft gel capsules, okay, they help the mature dendritic cell affect the naive T cells to become Th1. Okay, and basically we take a look at the whole pathology. You can see that our product, SimplyNature PPAR extracts, actually help or boost cell-mediated immunity and inflammation. So basically, we activate the immune system for the adaptive immune system in terms of the cell-mediated one. So this actually helps to fight the infection of cells, intracells, all right, intracells. However, that's not the only effect that we have. We also actually affect the antibody-mediated immunity as well. So that means that we can use SimplyNature liquid extracts, soft gel, powder extracts, both as a treatment and also a prevention. But as I said, in general, the general strategy for COVID-19 is definitely SimplyNature PPAR Plus tablets for the general public, those who are not infected, not sick, because number one, the tablets also help you to get to manage your underlying issues like diabetes, blood cholesterol, and give you all the nutrition that you need. However, once the patient is infected and is COVID positive, especially if they have some symptoms, you want to get them on the soft gel, the liquid soft gel first. And if they are serious, or if they are elderly and have many underlying conditions, you might really want to consider going under the extract powder or even liquid. In fact, one of our doctors have dealt with COVID-19 positive patients, and the patient is actually in their 70s. So straight away, our doctor actually put the patient on the liquid extract. So the good news is that the patient actually belonged to a family. Another member of the family also was positive. However, they did not take the liquid extract. The one that did take the liquid extract recovered and is now COVID negative. Unfortunately for this particular patient, that family member who was not on the liquid extract actually developed complications and actually passed on. So here we have in the same household, two persons in very close proximity, basically living in under the same roof, having two very different outcomes. So this is a very encouraging and effective example of a use of our product as a treatment and also protection for COVID-19. The doctor in question actually combined this with heavy dosage use of vitamin C. So it was a combination of SimplyNature liquid extracts and vitamin C, as well as some additional supplements. All right, but the two main supplements that our doctor used was actually vitamin C plus SimplyNature PPAR liquid extract. You want to take a look at the next slide. We can also see here that from this slides you can see the result. The result actually show that SimplyNature PPARs can significantly decrease bronchial inflammation cells infiltration. All right, so this is a direct, I guess, proof or study on lung cells, okay, on your lungs, on the effect of SimplyNature PPAR extracts on your lungs. So it actually prevents and reduces the inflammation. If you take a look at this next slide, it also significantly reduces bronchial mucus secretion. So both inflammation and the secretion of mucus are very important to avoid respiratory complications. And of course, COVID-19 actually starts in the alveolar, the infection of the alveolar. So straight away, this is a direct application, and it's evidence this is the science that proved why so many of our doctors are so effective with their patients using PPAR tablets, and when the patient is positive, using the soft gel extracts, the powder and the liquid to treat the patient. As we've mentioned before, the treatment for COVID-19 and lung diseases in general has always been the immune system. Of course, if it's bacteria-based like tuberculosis, we actually have antibiotics to deal with the infection. But when it's viral, the only valid strategy is to go after the immune system. So if you were to just go take a look at the approaches to treatment of COVID-19 right now by the numerous pharmaceutical companies. So we're looking at antibody transfers, we're looking at plasma. So it's all about triggering the immune system. And if you take a look at the summary of, or the conclusion of our research into allergies, these are some of the conclusions. That SimplyNature PPARs can significantly reduce the formation of allergic antibody, IgG and IgE. That we can significantly reduce the infiltration of bronchial inflammatory cells. That we can significantly reduce bronchial mucus secretion. And these results were actually from 2 weeks of use of SimplyNature PPARs feeding. So that means that the results are actually quite visible and quite quickly. They can be seen quite quickly. All right, let's move on to the last summary slide. And basically what we are saying today, our research shows the general pathology is a general understanding, of course, to be able to speak definitively like a drug, where we can make bold, specific claims, then additional research is required to confirm our hypothesis and our postulations. But right now, as you can see from the general understanding and pathology, you can see how our SimplyNature liquid extracts, soft gel extract powder, is able to help the dendritic cells mature and into the naive T cells into Th1, and that links straight away to cell-mediated immunity, and that's the intracellular, that fights intracellular infection. And that's not all, it links back to Th2, and that moves into the direction of antibody immunities. So, and here if you take a look at the last slide, the last statements are quite interesting because it shows that we have the potential to become a vaccine adjuvant. So that means that potentially, based on the general understanding, it's very likely that by taking SimplyNature PPAR extracts, you will actually increase the efficacy of vaccines when they actually come out. Now, definitely that makes SimplyNature PPAR tablets for the normal person, the non-infected persons, even a more ideal choice, because even our PPAR tablets contain all the active components that are found in our extracts. But of course, when a patient is already diagnosed as positive, COVID-19 positive, and they are showing symptoms or they have complications, or in this case, we are talking about lung infections, then tablets alone is not enough, because you want to move into the very strong therapeutic effects. And for that, you really need higher concentrations for reliable, consistent results, right? Because the patient is already not well. So that's why we use soft gels, liquid extracts, and powder for positive patients. All right, but here's the good news, right? It's even effective. It has the potential to be even a vaccine adjuvant. So really, there is very little reasons not to be taking SimplyNature PPAR plus tablets. In fact, I would like to close by just sharing that even our own doctors, many of our doctors have actually bought tablets for themselves during this time. And for me and my team over here at SimplyNature, we are still actually on the front line. In fact, 2 weeks ago, I was in the PGH vicinity, was meeting up with the head of the Cancer Institute in PGH. We were just exchanging ideas, and here maybe I can segue a little bit into cancer update. So when we showed the PGH oncologist about our research on cancer, he was so excited and so interested because number one, we actually have actual clinical trials. In fact, we're doing a double-blind test, but we have already published, um, cell models and animal models on cisplatin. Cisplatin, which is a very commonly used chemotherapy drug for about 6 to 7 different types of cancer, and oxaliplatin. And we showed that when cisplatin and oxaliplatin is exposed to, when the bone marrow cells are exposed to cisplatin and oxaliplatin together with our liquid extract, the bone marrow cells are protected from the cytotoxicity. So that's really great news. Even the oncologist at PGH was quite excited because as we all know, at PGH, many patients are on government grants. So they are not, they usually don't avail themselves to the more expensive immunotherapies, and their main mode is actually chemotherapy. And as we all know, chemotherapy has its side effects. So when the data was shown and the experiment was shown to have protective cytotoxicity protection, it was exciting. It was exciting for the oncologist because that meant that patients could go for chemotherapy and do better, right? And do better. So with this, I think I would like to wrap up for today so that we keep short our presentation and open the floor to Q&A. Before I end, I would like to once again thank you, all the doctors, for joining us today. I hope you enjoyed. I hope that I presented new data and information that is good food for thought. And more importantly, I hope I've equipped you with better understanding and new tools for you to be able to help and treat your patients. So today's topic was on lung diseases, and we've covered that from pneumonia to tuberculosis is always about infection. And from the integrative natural approach, naturally we would use supplements and dietary plans to basically address two main strategies. One is to reduce inflammation in the body, and the other is to boost the immune system. Compliance has always been a challenge to patients once they leave the clinic. So supplementation to reduce inflammation and boost immune system has always been the more reliable strategy. In general, for immune system support, we are talking about mild cases, so we're just talking about support or support together with conventional protocols like antibiotics for tuberculosis. We've always looked at the supplements that were able to boost the immune system, and the common ones are vitamin C, vitamin D, E, zinc, omega-3 fatty acids. All these are the common ones. And today I hope we got a clear picture that SimplyNature PPAR tablets actually contains all the vitamins A, B, C, D, E. It contains folic acid, it contains fatty acids, omega-3s, it contains chlorophyll. In fact, just 4 grams, 20 tablets of our microalgae is equivalent to 4 cups of spinach in terms of chlorophyll content. It's also still a superfood. It contains high quality plant protein. In fact, 140 grams of vegetables yield the same amount of plant protein as just 4 grams of SimplyNature PPAR Plus tablets. So as a general supplement for patients to boost their immune system, the SimplyNature PPAR tablets are most excellent. And taken in reference to COVID-19 season that we are in right now, I'm sure many patients are asking and wanting a tool to protect themselves as they go back out into the world because no work, no pay. I think the economy is really hurting and people have to get back to work. So they want to take something. Now, we can always go with vitamin C, vitamin D, vitamin E, zinc supplements, but when we talk about COVID-19 specifically, what makes a patient at risk is basically their pre-existing conditions. So although the general vitamin supplementation is great, they don't really address the underlying pre-existing conditions. Whereas SimplyNature PPAR Plus tablets have already been proven clinically to actually help manage blood sugar, blood cholesterol, deals with cardiovascular, deals with inflammation issues. So not only are they getting that immune boosting effect, they are also clearing up their pre-existing conditions, which really reduces their risk should they ever be exposed to COVID-19 and actually become infected with COVID-19. So that's the great strategy. So SimplyNature PPAR Plus tablets, the dosage that we want to recommend is 10 tablets 2 times a day for there to be a good effect. Now, when we deal with lung patients with lung diseases, then we move from just merely the tablets to really for treatment, we really need to go into the soft gel capsules, the powder, and the liquid extracts. And this is the same for COVID-19 positive patients. We look at the research today, and the research was very interesting. It was done specifically on, it was based on an allergy research, and they really looked into the immune system. In summary, it proved that our product really activated the cell-mediated immunity and control of inflammation, but also it also affected the antibody immunity as well. So it boosted both. Now, that's just great news. It proves why our doctors are having great effect in terms of treating patients with COVID-19 or COVID-19 positive. They've been using soft gels and liquids, and most commonly, they combine the soft gel or liquid with PPAR tablets and vitamin C. All right, so that's a very comprehensive approach. It deals with pre-existing conditions. It strengthens the body. It very actively and powerfully stimulates the body's immune system and response. Okay, so I think I will just end there. And if there are any questions, simply just type it in. I thank you for your time. The floor is open. Mr. Jack Wei is here. You can ask him questions. I will translate from his answers from Mandarin, and I'll translate your English questions to him in Mandarin. So once again, thank you very much. And don't forget, every month we'll be having a doctor's forum. Our calendar on the topics has already been set, but if there's something that's pressing that you want to know, feel free to drop us a note and we will take that into consideration. Thank you very much.